What I'm about to show you is not on the TV news, but it can leave your bank account empty before the end of the month. While politicians argue in Washington, the government has quietly reached a deadline that directly affects your health plan. And worse, there are many channels out there spreading confusing and incorrect information about it. I went to the official source, checked the most recent Medicare data, and I'm going to tell you what no one is explaining properly. There is a window open right now, a window that closes in 8 days on March 31st, and after it closes, you are stuck where you are until October. This is not an exaggeration, it's literally what the law says. So if you have Medicare Advantage or know someone who does, what I'm about to say in the next few minutes can significantly change your family's financial situation. Stay with me until the end, because in the step-by-step, I'm going to show you exactly what to do, in what order, and where to go to do it for free, without having to pay anyone for help. Let's start from the beginning. There is something called the Medicare Advantage Open Enrollment Period. In simple terms, the Medicare Advantage Open Enrollment Period. It happens every year between January 1st and March 31st. And what does that mean for you? It means that if you are in a Medicare Advantage plan right now, whatever it may be, you have the right to switch that plan for another one. Or, if you prefer, you can leave Medicare Advantage completely and return to Original Medicare, which is the federal government's plan, and still add a separate prescription drug coverage plan called Part D. There is no fine, no fee, no penalty of any kind for making this change now, within this period. But pay very close attention to this technical detail that can block everything if you don't do what I'm about to show you. There is a huge difference between leaving Medicare Advantage now, within this time frame, and leaving later. If you've been in your Medicare Advantage plan for more than a year and decide to leave after March 31st without a special reason accepted by the government, you will return to Original Medicare without additional protection. And then you are exposed to paying 20% of all your medical costs with no cap, no spending limit. That may sound small, but if you need surgery, hospitalization, cancer treatment, 20% can mean tens of thousands of dollars out of your own pocket. The plan that protects against this is called Medigap, or Medicare Supplement, and it has a very specific rule. To enroll in Medigap without going through medical underwriting, without the risk of being denied or paying more because of pre-existing conditions, you need to be within your first 12 months of Medicare Advantage. If that time is already passed, you lose that automatic protection in most states. That changes everything about your decision, and that's exactly why the next 8 days matter so much. Now let me tell you what happened recently that is causing extra confusion in the market. On March 2, 2026, CMS, the Centers for Medicare and Medicaid Services, the federal agency that oversees all of Medicare, announced an emergency action. They suspended new enrollments in all marketing of Medicare Advantage plans from the company Elevance due to irregularities in the risk data of those plans. What does that mean in practice? If you were thinking about enrolling in an Elevance plan during this period, that option is locked until at least March 31st. This directly affects the switches some beneficiaries were planning, and many channels are still giving outdated information about which plans are available to switch into right now. That's why I went to the official Medicare.gov to verify what is valid today. And on March 6th, AmeriHealth confirmed changes to its MA plans during this active enrollment period. In other words, the market is moving. Those who are asleep will wake up stuck in a bad plan. Now I'm going to give you the number that matters most in this conversation: 2.6 million. That's the number of Medicare Advantage plans that were terminated for 2026. 2.6 million beneficiaries were forced to switch plans or make a decision. If you were one of them and still haven't done anything, you were automatically moved into a default plan that may not include your doctors, may not cover your medications the way you need, and may have a different hospital network than what you're used to. Now what few people know is that there's a loophole in this new rule that can benefit you if you act quickly. Even if you've been in a Medicare Advantage plan for more than 12 months, there is still a way out with protection in certain states. Some states have their own laws that guarantee additional Medigap protections regardless of how long you've been in the plan. These states include New York, Connecticut, Massachusetts, Maine, and some others with specific rules. If you live in one of these states, the window of options available to you right now is different from someone in Texas or Florida, and that completely changes what's worth doing before the 31st. But pay attention. Even in these states with extra protection, you still need to act before the window closes if you want the change to take effect in April. Because if you wait, your next opportunity will be in October during the annual open enrollment period, with coverage only starting in January 2027. That means staying 6 more months or even a full year stuck in a plan that doesn't work for you. And now I need to tell you about a type of situation that is affecting many families that major channels are not explaining. There are special situations called special enrollment periods, or SEPs, that can open a window outside of these normal dates. For example, if you moved to another area, lost employer health coverage, left a long-term care facility, or if your current plan took an action that negatively affects you, like removing a medication you use from its formulary. In these cases, you may have the right to make a change after March 31st. These cases need to be checked individually on Medicare.gov or by calling the official Medicare hotline, and I will give you that number shortly. Before I show you the final step-by-step, I need to give you a warning about the mistake that 90% of retirees make when trying to handle this on their own. The most common mistake is going to Medicare.gov, finding a new plan that looks good, and switching without first checking 3 essential things. First, whether your current doctors are in the new plan's network. This needs to be verified directly with the doctor, not just on the plan's website, because networks change and the site is not always updated. Second, whether your specific medications are covered in the new plan's formulary at the same coverage level you have today. It's not enough to know that the drug exists in the formulary. You need to check the tier, the level, because the same medication can have a $10 copay in one plan and a $90 copay in another. Third, whether the hospitals and specialty centers you use are included. This is especially important for those undergoing cancer treatment, dialysis, or regular specialist care. Switching without checking these 3 points is the mistake that puts people into financial trouble that could have been completely avoided. Now, finally, here is the complete step-by-step for you to act in the next few days. Step 1. Go to Medicare.gov. It's the official federal government website, free, secure. There you'll find the Plan Finder, which is the plan comparison tool. You enter your zip code, your medications, and your preferences, and the system shows the plans available in your area with estimated costs for your specific case. Step 2. Before deciding anything, call your primary doctor and ask directly, do you accept Plan X for 2026? Use the exact name of the plan, not the insurance company name, but the specific plan name. This phone verification takes less than 5 minutes and can save you months of headaches. Step 3. Check the new plan's formulary. On Medicare.gov, you can enter the names of your medications and see exactly how much you'll pay in each plan. Compare the estimated annual cost, not just the monthly copay. Step 4. If you decide to switch, submit the request through Medicare.gov or call the new plan you chose directly. The request must be made by March 31st to take effect in April. Step 5. After submitting, keep your confirmation number. You will receive a letter with the details of the new plan. Check that everything is correct. If there is any discrepancy, contact them immediately. And if you need free help to evaluate your plans at no cost, there's a government program called SHIP, which stands for State Health Insurance Assistance Program. These are independent counselors funded with public money, trained specifically to help with this type of decision. They don't sell anything, they don't earn commissions, they are there to help you. To find a SHIP counselor in your area, go to shiphelp.org or call 1-800-MEDICARE, which is 1-800-633-4277. Now let me close with what really matters. No one is going to knock on your door to tell you that you have 8 days to make an important decision. No urgent letter will arrive tomorrow. The government will not call you, and the channels that thrive on sensationalism will keep publishing headlines about $1,200 increases, mixing information from different programs, different dates, different rules, just to keep you confused and clicking. You deserve clear information, information you can actually use. Your health plan is just as important as your Social Security check. In some months, it matters more because a single hospital stay without the right coverage can wipe out years of savings. So do this now. Before you close this video, write down somewhere visible, on the fridge door, on the bathroom mirror, somewhere you'll see it. March 31st, Medicare Advantage, check plan, act. 8 days, 1 decision, and the impact can last months or years. If you want to keep receiving this kind of direct, no-nonsense analysis based on official sources, subscribe to this channel now. Every time an important deadline approaches, every time a rule changes, every time there's information that affects your money or your health, you'll be notified here, in advance, clearly, and without being left more confused than when you arrived.
Now, I'm going to dive deeper into something that was left pending and is absolutely critical for anyone evaluating this decision over the next few days. A lot of people who watch videos about Medicare come in with the same question. But I've had my plan for years. Why would I need to change now? And that's a fair question. The answer is, maybe you don't. But you need to know whether your plan still works for you in 2026, because the plan you had in 2025 may have changed radically in January without anyone clearly informing you. This happens every year. Medicare Advantage insurers have the right to change coverage, doctor networks, drug formularies, and copay structures each year. They send a letter called the Annual Notice of Change every September. Most people open the envelope, see a bunch of small print paperwork, and throw it away. That's the moment when the decision is made by inertia, and inertia in Medicare can be expensive. So I'm going to ask you 3 questions right now. Answer mentally, honestly. First, do you know exactly which doctors are in your plan's network in 2026? Not in 2025, in 2026. Second, have you checked whether all your medications are still in your plan's formulary with the same level of coverage? Third, if you had to use the plan in the past few months, were you satisfied with the coverage, or did you run into unpleasant surprises when it was time to pay? If you answered no to any of these questions, the next 8 days exist exactly for you. Now, let me explain something that separates Medicare Advantage from original Medicare in a way most videos never properly explain, because they're afraid of sounding biased. I don't have that fear, because my only goal here is for you to make an informed decision. Medicare Advantage is a private plan. A private insurer receives money from the federal government to manage your coverage. In return, these plans usually offer extra benefits that original Medicare does not cover, like vision, dental, hearing, gym memberships, and in some cases even food and transportation. That sounds great, and for many people it is great, but there is a hidden cost that doesn't always show up in advertising. Medicare Advantage works with restricted networks. That means the plan only covers doctors and hospitals that are part of its contracted network. If you go to an out-of-network doctor, you either pay everything out of pocket or pay a much higher percentage. In HMO plans, which are the most common and usually the cheapest, you often need prior authorization to see a specialist. This is called prior authorization, and denials of prior authorization are one of the main complaints from Medicare Advantage beneficiaries in the country. Original Medicare, on the other hand, is accepted by almost any doctor or hospital in the United States that accepts Medicare. No restricted network, no required referrals. You go to any specialist you want, whenever you want. The limitation is that without a Medigap plan on top, you are exposed to uncapped costs. There is no universal right answer. There is the right answer for your specific case, considering your health, your doctors, your medications, and your financial situation. And that evaluation is exactly what you can do for free with a SHIP counselor before the 31st. Now, I want to talk about something few channels address because it's a sensitive topic. What happens if you are in active medical treatment in the middle of switching plans? If you are undergoing chemotherapy, dialysis, have had a recent surgery, are in regular psychiatric care, or any other ongoing treatment that depends on specific doctors and facilities, switching plans requires extra caution. Before making any change, you need to call every doctor currently treating you and confirm 2 things. First, do they accept the new plan you are considering? Second, is the treatment you are undergoing already authorized under the new plan, or will it need to go through a prior authorization process that could cause delays? Interruptions in treatments like dialysis and chemotherapy due to coverage issues are both medical and financial emergencies. It's not worth the risk of a poorly planned switch. If you're in this situation, the recommendation is to call SHIP before making any decision. They have specific experience with transition cases during active treatment. Now, let me talk about deadline penalties, because this is where many people really get hurt. Medicare has 3 types of late penalties that are permanent. That means you pay more for the rest of your life. The Part B penalty. If you did not enroll in Part B when you were first eligible and you did not have employer health coverage as a valid reason for the delay, you pay 10% more on your Part B premium for each 12-month period you delayed enrollment, forever. The Part D penalty. If you went more than 63 consecutive days without drug coverage after becoming eligible for Medicare, you pay a permanent surcharge on your Part D premium. This surcharge is calculated based on how long you went without coverage. These penalties are separate from the current Medicare Advantage open enrollment period situation, but I mention them because many people considering leaving a Medicare Advantage plan and returning to original Medicare get confused about whether they will be penalized. The answer is no. If you act now within the legal time frame and ensure continuity of coverage. What can trigger a penalty is going without drug coverage for more than 63 days during the transition. That's why it's essential that if you decide to leave Medicare Advantage and return to original Medicare, you also enroll in a standalone Part D plan at the same time, not one after the other, in the same request on the same day to guarantee continuity. And for those thinking about adding Medigap now, welcome to the most complex part of this conversation. Medigap, as I mentioned before, is supplemental insurance that fills the gaps in original Medicare. It pays your share of costs, your co-insurance, your deductible, and in some plans even covers emergencies outside the country. But it is sold by private insurers, and the price varies a lot. The same Medigap Plan G, for example, which is currently the most popular among new beneficiaries, can cost $120 per month in one state and $280 in another, depending on your age, gender, and location. And here is the point no one tells you in advertisings. Medigap does not cover medications. To have drug coverage, you still need a separate Part D plan on top of Medigap. So full original Medicare for most people looks like this. Part A, which is hospital coverage and usually free. Part B, which is medical services and has a monthly premium. Part D, which covers medications and has a monthly premium. And Medigap, which covers your costs under Part A and Part B and also has a monthly premium. 4 pieces, 4 separate payments, but with very comprehensive coverage and no restricted network. Compare that to Medicare Advantage, which usually has a lower monthly premium or even zero because the government pays the insurer directly, but comes with restricted networks, prior authorization, and out-of-pocket costs that vary greatly depending on how often you use the plan. People who use the healthcare system less tend to do better with MA. People who use it more, especially specialists and expensive brand-name medications, tend to do better with Original Medicare plus Medigap. That is the core logic of the decision, and it is personal, based on your health and how you use the medical system. Now, one last thing before we close. Some people will watch this, realize they need to act, but they'll leave it for tomorrow, and then the next day, and they'll reach March 31st at 10 p.m. trying to make a last-minute change in the system and run into technical issues or need information they don't have on hand and miss the deadline. Don't let that happen to you. Today, right now, before you close this video, do just one thing. 1. Go to Medicare.gov and open the Plan Finder tool. That's it. You don't even need to decide anything today. Just go in, enter your zip code, and see what's available in your area. It takes 5 minutes and gives you an overview of what's possible before the 31st. Then, if you want help understanding what you found, SHIP is available. The number is 1-888-633-4227. Free. No obligation, no sales. You worked your whole life, paid your taxes, contributed to this system. You deserve health coverage that actually works for you, not for the insurance company. 8 days, 1 decision. Take care of yourself. If this content helped you, Share it with someone you know who has Medicare Advantage and may not be aware of this deadline. Often, the information that saves someone comes through a message from a family member or friend. You can be that person for someone you care about. And subscribe here, because when the next important date comes, you'll want to know before it turns into confusion on other channels.